Hey there, welcome to the Dr. Lean Body YouTube channel. Please like, share, subscribe if you like the content. Today's content is testosterone. Men, if you have noticed a decrease in energy levels, endurance, drive and motivation, mood changes, sleep changes, increased body fat compared to what it used to be, decreased muscle mass and strength in comparison to your more youthful self, then checking testosterone levels is probably a good idea. It's a very common problem in men these days. There's a generational decline of testosterone levels in men. Your grandpa had more than your father, and your father probably has more than you. It has to do with a decrease in nutrients in our foods and increase in harmful toxins in our culture and environment. Testosterone is very important for quality of life. It's something that has been shown in a review of literature to decrease cardiovascular events in patients that are appropriately treated when they have low testosterone in comparison to men with low testosterone that is not effectively treated. So there is an association of improved cardiovascular health with adequate testosterone level in comparison to men with low testosterone levels. There is a benefit to diabetic patients that have been seen. There's some literature showing increased insulin sensitivity in those patients that have adequate amount of testosterone in comparison to men with low T. There's a problem with insulin resistance a lot of times. So that's another area of health that seems to be improved with adequate testosterone. Having the energy to come home and actually, do things in the yard, play with the kids, just habits and hobbies, taking care of things that you wouldn't necessarily feel like doing when you get home from work. It's much easier to do typically when you have adequate testosterone versus a very low testosterone level. The ranges on lab work are very wide as far as what's considered to be normal in a man. There's most labs anywhere from 250 to 1150 kind of range. I'd much rather be on the high end of that range in comparison to being on the low end of that range. There's huge quality of life issues and differences in somebody that has a testosterone of 250 versus somebody that has testosterone of 1100. There's definitely some improved benefit in joint health. As your testosterone levels fall, you tend to have a bit more joint pain and stiffness in comparison to more youthful testosterone levels. There's definitely an association with improved mood in most patients that I've treated. I've had patients with anxiety that improved. I've had patients with depressions that has improved with therapy. I've had patients with sleep issues that have improved on testosterone therapy. So it can affect those areas of life as well. Important for sexual health. It's important for sex drive as well as erection quality. I've helped patients with those sexual health issues as well with appropriate testosterone therapy regimens. It's beneficial for memory as testosterone levels fall. Memory declines. Mental clarity and focus tends to be better with adequate testosterone in comparison to the low testosterone levels. So being able to function at a higher level with your job and in life in general is typically improved with adequate amount of testosterone in your system. The literature that I've reviewed has not shown evidence for any type of increased risk when it comes to prostate cancer. I know that's something that patients come to me concerned about when they start or thinking about starting testosterone therapy, but there's no literature out there showing an increased risk with testosterone therapy. The data seems to show us the same risk either way, prostate cancer in somebody that has low T that's treated versus the patient with low T that's not treated. So really no association of an increased risk with therapy. There was a study back in the 1940s that kind of started that myth, basically. I believe 3 patients were in the study, and very poor design study in general. So I wouldn't base my opinion upon that study for sure. But there's been multiple, good studies done since then, not showing any increased risk of prostate issues or cancer with testosterone therapy. Levels that are suboptimal can still be associated with adverse symptoms. So having a what I call a suboptimal level can still benefit from testosterone therapy and treatment, pushing to a more youthful, optimal point, improve quality of life, and definitely worth thinking about and looking into. Like I say, I'd rather be around that 900 to 1100 range in comparison to running about a 2 to 300 range, or even a 3 to 400 range. When you do lab work, I'd always look into free and bioavailable amount of testosterone in addition to your total testosterone, because I've checked those levels in my patients, and see a lot of patients that have decent amount of total testosterone, but they have very low free or bioavailable testosterone levels due to usually an increased amount of sex hormone binding globulin, which binds to the testosterone as well as other hormones, and kind of binds them up and keeps them from being able to do what they need to do. So that patient that has a total testosterone of 500, but their free testosterone's of 50, that's a patient that will still benefit from testosterone therapy because their free testosterone is definitely too low. There are natural ways to help increase the amount of free testosterone. Eating a diet that's high in greens seems to help. Stinging nettle is a herbal kind of therapy that can help decrease that binding globulin protein a bit, and secondarily increase the amount of free hormone. So there are some natural ways to try to help with that ratio between the free and total amount of testosterone. Not a lot of side effects associated with testosterone therapy, but the most common thing I see is polycythemia related to therapy, where the blood counts get a little on the thick side. It happens in probably 15 to 20% of my patients, and usually in those folks that are a bit on the dehydrated side, don't drink enough water, or smokers typically have increased risk. People that maybe drink a little bit on the weekends, alcohol-wise, that can be an issue as well, just due to more dehydration than anything else. But easily managed, doing a phlebotomy or blood donation every so often is a easy way to help keep the blood from being as thick when you're on a testosterone therapy regimen. So that's the most common side effect that I've seen with therapy. Usually not a lot of adverse mood problems with testosterone therapy. That's another common question patients come to me or ask me about when they're thinking about starting testosterone therapy. Is it going to make them more aggressive or mean? And I tell them, with a medically supervised treatment protocol, it should not be an issue. That's maybe with an abusive type pattern of use, yes, but with appropriate medical dosing, no. I've not seen that to be a trend or association at all. It tends to improve mood in a lot of patients. So it's definitely played a big role in my life. Quality of life has definitely improved significantly since getting to a more consistent, youthful spot with testosterone therapy. And the way that I advise dosing is twice a week dosing with the testosterone Scibinate. Doing smaller doses more often works out better for the body. Your body cannot assimilate a huge dose of testosterone at one time. You tend to offload a lot of metabolites such as estrogen and DHT when you do a big dose of testosterone. Doing the smaller dose tends to decrease the amount of those metabolites such as estrogen and DHT, and also increases the amount of free testosterone. So you get more benefit and less side effects from doing a smaller dose more often. And a twice a week regimen tends to work out best with the Scibinate ester with testosterone, which is what we most commonly use. Due to the half-life of the ester in the medication, it starts decreasing around day 5. So once a week dosing, which is typical for most clinics, is going to put a patient on a bit of a roller coaster ride where they're down and kind of up and then down a little bit and back up. So doing twice a week dosing to keep levels more stable is a better way of dosing. Plus, as we've already talked about, the decrease in metabolites associated with the smaller dose more often. So in my opinion, that's the best way to manage testosterone therapy. You can also do micro dosing, which is just a daily dose of a small daily dose of testosterone can be done. It's just a bit of a problem related to the number of injections you have to do if you want to do it that way. But there are studies looking into that kind of dosing regimen that show good benefits. When you do more of a subcutaneous dose, you tend to have less risk for polycythemia versus the intramuscular dose. So if you're doing a micro dose regimen, that tends to be better tolerated sub-Q versus in the muscle, which is easier to do with a compounded therapy. The retail type pharmacies typically, and most pharmacies, I think 99% use Cottonseed, which is not a natural therapy for the human body. It's very inflammatory, can cause some side effects and problems, so not the best product to use. In my opinion, I think grapeseed oil or sesame oil or MCT oil, those type oils are a lot less inflammatory, a lot less side effects with doing testosterone in that base or that oil as your choice of therapy. So I tend to utilize compounded therapy for my patients a lot. Just tends to be better tolerated. So that's a lot of information on testosterone, the benefits of testosterone, the potential side effects of testosterone therapy. There's tons of other stuff to kind of dig into and talk about, but that's kind of a broad overview of testosterone in men. Testosterone is also important for women, for sure. So women, if you struggle with body composition, recovery, decreased sex drive and sexual function, it's always something to kind of think about checking with your doctor as well. So it does tend to help a bit when it comes to body composition, recovery. If you're working out quite a bit and you're just not recovering well, you're sore all the time, you have a hard time putting on muscle tissue and losing body fat. It's always something to check in a woman as well. You want to keep your levels at a good youthful spot, and just like a man would. Of course, your youthful testosterone level in a lady is going to be a much lower level in comparison to your typical man. But finding the right amount to put you in a good youthful spot is also beneficial for you ladies out there as well. I'm definitely going to do more videos talking about hormones in women, testosterone as well as estrogen and progesterone, and digging into the details of that too. So I hope you enjoyed the content. Like I say, if you did, please subscribe to the channel and share, and we'll look forward to doing more content in the future.